Well, no, thanks for staying with us. The banks and the select banking stocks are making a comeback. Metal as a category also seems to be participating. But the big question now is that now that India is in the middle of the third wave, the Omicron wave, the initial reports, even though they are indicating and suggesting that this virus is strong in terms of spread, it may not be very powerful in terms of impact and in terms of severity and mortality. Is the ground report different? Now we are also entering what could be called as the second week or the crucial phase where the Delta variant and the original variant in a sense have had created medical issues. So let's take this conversation forward, understand that the preparedness of hospital and what is essentially happening to the entire wave in terms of hospitalization. And to do that and to discuss that, it gives me great pleasure to bring on board Sangita Reddy of Apollo Hospitals. Ms. Reddy, good morning. Thank you for joining us. Ms. Reddy, while the general view about the Omicron virus is that it's spreading, but it is infecting, but it is not big in terms of severity and in terms of mortality. At Apollo Hospitals, what's the update in terms of the hospitalization, the beds occupied? You're in a perfect position to share the actual reality with us.
So good morning and a happy new year to all of you. And I believe that despite this, we must come through and have a good year in 2022. I'm sure all of you remember that we have consistently said that there will be a third wave, but the impact is, mitigatable or reducible. And I think that's what's happening right now. Like you rightly said, the severity of the Omicron is much less. However, its contagiousness is far, far higher. We have seen a surge or an increase in the number of cases across all our hospitals. We have ramped up home care because we clearly understand that we can manage most of these people at home. So we have ramped up our home care facilities. We are doing telemedicine. Apollo 24/7, which is our teleconsult, has become very active once again. And we continue to give guidance, as is our diagnostic, because people who are thinking that this is a very mild virus, there's no need to test, we'll just live with the flu or the cold for 3 days. I would like to highlight that we have the Delta variant and the Omicron coexisting at the same time. It's very important to test to find out what you have so that treatment can be appropriate, number one. And also important to test because even if you just have the Omicron, your safety precautions to ensure that you do not spread it have to be far more than if you are having just a cold. So these are the simple guidelines. But the fact is that, with India reporting 37,000 cases today, which is almost 10,000 cases more than it was just 2 days ago, we are beginning to see an upsurge. We must be careful. The government, the hospitals, everyone will do everything they can. But it's in the hands of public to be cautious and stay safe, to wear their mask, maintain social distancing. And please, please wash your hands. You've learned these rules over the last 2 years. This is the time to practice them in full sincerity once again.
Right. Big thank you for saying that and reiterating that once again. That's what we've been doing on the channel. That COVID is all about self-precaution. It is all about masking and social distancing. Ms. Reddy, one aspect of looking at the Omicron virus is that we can say, okay, severity is not there, but if the sheer number is so large and the spread is so large, in terms of number of bed requirement, even though as percentage of the total people who are affected, it's not going to be large, but the sheer numbers would be so large that could there be a crunch?
So you've asked an absolutely perfect question, and I think this is something that all of us are preparing for. The important aspect is that the vulnerable population will still remain vulnerable even with a cold or a pneumonia. So we need beds for them. We do not want what's happening in other countries. I heard, an incident which occurred in a small town in the United States called Tulsa, where a person with an MI was refused a hospital bed because the hospital was overwhelmed with Omicron cases. And therefore, the routine patients, the heart attacks, the strokes, the cancers, we do not want to deny them care. And therefore, it's very important for us to be careful and to keep the numbers of Omicron infections low so that the overall number and the incidence does not overwhelm us. So this is to say that even if 3% of the patients who come Omicron positive need a hospital bed, this is still a very large and significant number at the estimated rate of 6 to 7 lakh patients per day at India's peak. So it is important for us to be careful and ensure that we do not get overwhelmed. That risk is still real and live. And therefore, like at Apollo, we have reopened the hotel room initiative that we had so that people can stay isolated and be supervised by telemedicine. We continue to push for more home care and self-isolation so that we can treat people, on the phone or on the video consult. So we have to use all the capability and all the learning of the last 2 years and work together. So we're sharing whatever new updated protocols we have with every hospital, every nursing home who wants it. Let's just get together, work, and make sure that the hospital beds as well as the healthcare workers are not overwhelmed.
Dr. Reddy, good morning. This is Nayantara. The other question that I had for you, and this is also based on an interview I was watching with a South African doctor, and we've been all reading about this. So just whether Indian medical experts, what are they saying? Can the Omicron actually be the endemic? The symptoms do seem to be milder. The protocol is not as stringent when one does turn out to be positive. Is that the silver lining? Can this really be the endemic?
So this is something, Nayantara, that we're all, really hoping for. And like we were discussing with Nikunj earlier, it is a series of moving parts and variables. We must estimate the scenario as well as we can, prevent it. So anybody who's saying just go out there and get yourself infected because after that you're protected, that is not an appropriate behavior or an appropriate guidance. It is, however, that if this is mild, more people get infected, in addition to the fact that they should be vaccinated. Because we must remember that the vaccination is actually one of the biggest things which is protecting us. And I really want to call to attention to a few of the points. Teenagers who are now eligible, India's vaccinated 8 million teenagers in the last 2 days, and I'm really happy about that. The booster doses for the elderly and those who are eligible. And also very important, people who have had the first dose but not taken the second. And that number is also fairly high, including in healthcare workers and frontline workers. I urge everybody who has not taken your second dose to please come forward and take it. About 2 months ago, everybody started getting complacent that we were over this pandemic. We are not. We hope that it's becoming endemic, but we are not yet over the pandemic. I hope that answers the question.
Yes, the pandemic still is here. And Dr. Reddy, since you brought up vaccination, it started for the 15 to 18-year-olds. The precautionary booster dose will go live from 10th of January. Now, in America, for example, they've been saying if you're taking the Pfizer, the booster dose should be Moderna, vice versa. In India, also, the debate is on if you've got Covishield, should the third one be Covaxin? What are the recommendations?
So clearly, first of all, those who are eligible must take a booster dose. That's important. The second aspect is that all studies on Covishield showed that you can take the third dose of Covishield. But doctors also feel that this is because at that point of time, international studies, WHO had not yet approved Covaxin. So the recommendation is from many clinicians to move to the other platform. That is, if you've taken Covishield, take a booster of Covaxin and vice versa. But either way, both vaccines are protective. Please go ahead and take your booster as soon as you're eligible.
That is, of course, the big message and something we've been talking right here on ET Now, doing our bit to spread awareness. Please follow the COVID-19 protocols. Please stay masked up. Please be careful and definitely go get vaccinated. Dr. Reddy, thank you so much for taking the time out and joining us live today on The Market.